Cruising into the State House as the third president of the United Republic of Tanzania since independence, the late His Excellency Benjamin William Mkapa left behind conspicuous landmarks still lingering in the memories of every Tanzanian. However, with all the achievements that marked Mkapa's leadership glory, many still wonder as to why he lined up health for a foundation.
I remember being the Deputy Minister for Health during his time in office, that he had a keen interest when it comes to health issues. To start with, President Mkapa was very keen on the fight of HIV AIDS. And the reason is during that time, the pandemic was such that it had a huge effect, not only on the health of the people, but also on their economic status. And for that matter, he had put in place a lot of programs to make sure that we fight HIV AIDS pandemic during those times. So we had achieved a very good success in the fight against HIV AIDS. But later on, he realized that the most important thing was to work to make sure that the health systems are functioning rather than fighting one particular disease. And this is the reason why we see today our health systems are quite strong.
One of the phenomenal milestones achieved during this time was establishment of the National Health Insurance Fund. The fight against HIV resulted in reduction of its prevalence in the country from a record high 8.1% in 1995 to 6.5% in 2004. During the late Mkapa's era, there was a substantial increase in the number of medical doctors graduating annually from below 60 in the late 1990s to over 190 in 2005. All these collective efforts led to the downfall of maternal deaths from 854 per 100,000 live births in the year 2000 to 721 deaths per 100,000 live births in 2005. All these achievements didn't mark end of the road for the late Mkapa, as there was a strong quest to deploy more efforts in fighting persistent health sector challenges. As a consequence, he established a foundation barely 6 months after his State House exit. He had a unique passion and vision for a foundation that was 100% Tanzanian, managed by Tanzanians, to bring about homegrown solutions in the health sector.
He had confidence in the people that could run his foundation. And he also had confidence in the capacity of Tanzanians when it comes to health provision. And for that reason, when he started the foundation, I remember being the first chairman of the foundation. We had everybody on board who was a Tanzanian, not only in the board, but also the management. So, and it has proven that he had the right vision, and we have done very well. And I'm happy to say that I'm proud of this foundation.
15 years later, the Mkapa Foundation, BMF, has grown into an institution playing a vital role in supporting government's efforts in building a better health sector for the nation. Through various projects such as service delivery, health system strengthening, and emergency response, the foundation has reached 26 regions of Tanzania, bringing hope to the underserved communities.
For 15 years of our existence, we have reached and impacted the lives of approximately 20 million people in Tanzania, thus supporting the government in tackling the HRH crisis, which is registered at a 50% shortage of the required health workforce across the country.
Halmashauri yetu ya Musoma imefaidika kwa kiasi kikubwa na huduma zinazotolewa na taasisi hii ya BMF. Kwa mfano, katika kituo chetu cha afya cha Murangi tumekuwa tukipokea madaktari wanaofadhiliwa na taasisi hii ya BMF, ambao madaktari hawa wametusaidia sana kuboresha huduma za upasuaji kwa mama wajawazito, ambapo wamesaidia sana kupunguza vifo vya mama na mtoto na rufaa kwenda hospitali ya mkoa.
BMF has proudly executed the solutions in very close collaboration with the government, that is the Ministry of Health and President's Office, Regional Administration and Local Government. And it has resulted in the deployment of about 9,000 health workers in overall, which is a pool of a mixed facility and community-based health workers that have worked and continue working in hospitals, primary healthcare facilities, port of entries, and even in training institutions.
Niliajiriwa Mwaka 2019 kwa taasisi ya Benjamin Mkapa nilipewa majukumu ya kumhudumia mama na mtoto na wagonjwa wanaolazwa katika maodi hapa kituoni. Wakati nafika kituoni, kwa mama wajawazito wengi walikuwa wanapewa rufaa kwenda mkoani kwa ajili ya kufanyiwa huduma za dharura, lakini tangu nimefika nimekuwa nikiwafanyia wajawazito wote huduma zote za upasuaji wa dharura na wote wenye matatizo mengine yoyote yanayohusiana na uzazi.
Zamani tulikuwa tunapata shida ya kupata huduma, tulikuwa tunaenda Msoma. Kwa sasa tunapata huduma kwa hapa Mlangi, na hapa nilipo na watoto wawili wote nimejifungulia kituo cha Mlangi. Na kwa sasa hivi kituo cha Mlangi kinatoa huduma nzuri na mpaka ya operation tunaipata. Labda itokee emergency kubwa na tuweza kufika Msoma.
Our rapid response to emerging outbreaks which happened in 2020, such as COVID-19, is commendable. The Mkapa Foundation was one of the first local entities that responded promptly to collaborate with the government, development partners, and civil society organizations by ensuring risk communication, community education was given priority in highly affected regions and targeted audiences.
Kupitia taasisi ya Benjamin Mkapa kwenye huduma ya afya wametupatia elimu na vifaa vya kwenda kutolea huduma ya afya kwa jamii. Tunahamasisha jamii hususan uzazi salama, TB na HIV na masuala ya lishe. Kwa wilaya yetu kuna jumla ya wahudumu 125 na kila mhudumu mmoja kwa mwezi anahudumia kaya 48. Wahudumu 125 tunahudumia kaya 6,000 ndani ya wilaya Mkuranga.
I have personally seen the work of the foundation when working under the Ministry of Health in the past 5 years, and currently under my new portfolio, President Office, Regional Administration and Local Government. Benjamin Mkapa Foundation has been complementing the government priority greatly. For example, they have played a crucial role in supporting the government in the reproductive, maternal, newborn, child and adolescent health, especially to ensure women and children have access to quality medical care services in rural areas by investing into human resource for health, including community health workers.
Our promise is to continue honoring the legacy of the late President Mkapa, who was well known as an ardent and visionary leader, a reformist, a diplomat, and a person who believed in self-sustainability for development. It is from these values of His Excellency Mkapa that tempted us to the foundation to establish an endowment fund which will ensure perpetuity of the organization in terms of long-term sustainability of its function, of reaching the mission and objectives, our drive towards self-reliance and institutional development.